From movies like Outbreak and Contagion to recent real-life headlines, the fear of a national or worldwide medical emergency, natural or terror-related, becomes more real every day, especially for the teams of first responders, public health officials, and national governments who are responsible for public safety. Responding to a potential epidemic involves a myriad of people and an even larger web of information. Who, what, when, why, and how are the big questions influencing the sharing of this information in the public interest. The following scenario depicts a fictional medical dilemma and highlights where secure information sharing technology connects the right people with the right data at the right time. A woman arrives in a Maryland doctor's office with a combination of symptoms: high fever, headache, shortness of breath, and a spreading rash. Throughout the day, several people in the District of Columbia arrive at doctors' offices and emergency rooms with similar symptoms. For each patient, the general practitioners and emergency room doctors enter symptoms and test results into their computer systems. Utilizing software developed by Raytheon Trusted Computer Solutions, hospital systems are linked with the Center for Disease Control's monitoring systems. No personally identifiable information is transmitted, but all symptoms and associated test results are shared. CDC analysts and researchers perform analysis on all data coming in, searching for trends. Analysis reveals that these cases are possibly related due to the similarity of symptoms, the ineffectiveness of standard treatment, and the close proximity of the cases. Alerts are sent to the appropriate CDC officials and an investigation begins. The CDC sends out alerts to all regional hospitals, healthcare practitioners, and first responders to watch for any additional cases. Notices are also relayed to other states' health officials as a precaution. By the end of the day, hospitals in New Jersey, Ohio, and Nebraska report the admittance of patients with similar symptoms and test results. The number of affected individuals is growing. The CDC initiates the protocols to alert national incident response centers, transportation authorities, and the media. In addition, the World Health Organization is brought up to speed. By day's end, thousands more across the nation are admitted to hospitals with similar symptoms. As test results come in, CDC researchers cross-reference the results with all known diseases and see commonalities. Further patient queries reveal that all infected people have eaten the same popular, nationally distributed processed food product. All health organizations, the manufacturer, food suppliers, grocery outlets, and law enforcement are notified. Working with the manufacturer, the cause of the contamination is found and destroyed. The medical community is informed of the source of the illness, and a remedy is quickly identified. The patients are responding well to treatment, media outlets are briefed, and public alerts canceled. As highlighted in this scenario, critical information must be shared securely between key participants to ensure a swift resolution. Many disparate sources of secure information must be accessed and shared between government, medical, and corporate entities. Access to secure information on private and public clouds is enabled through Trusted Thin Client, or TTC, from Raytheon Trusted Computer Solutions. Trusted Thin Client enables authorized individuals to securely access data from multiple organizations with varying levels of sensitivity using a single desktop configuration. The network or cloud separation is maintained in the data center, ensuring security. Authorizations and permissions are quickly and easily verified for individuals needing to collaborate in times of crisis. Although users can access data, no information resides on the endpoint device, and cut and paste actions between networks are not permitted. Sensitive data remains in the secure cloud environment. For people in the field and mobile users, TTC can be remotely enabled via an encrypted USB memory stick or secure digital memory card. Having access to critical sensitive information is essential in times of crisis, but key stakeholders may also need to share information within and between organizations and agencies. Securely sharing information between isolated networks or clouds is enabled through the use of a transfer solution or guard, such as Trusted Gateway System or TGS. TGS is a multi-directional guard with configurable inspections to ensure that sensitive data is not released to unauthorized recipients. TGS also has robust audit capabilities. Auditability of data can be critical to ensuring data is protected from accidental or intentional leaks or loss. In the case of our medical emergency outbreak, responders not only need access to multiple private clouds, but also public clouds such as the Internet for research and analysis. Web browsing between sensitive and unrestricted networks can unknowingly introduce risks, like malware or viruses. WebShield, a web browsing guard, enables secure web searches between sensitive clouds and lesser restricted or open ones. WebShield can apply customizable restrictions on the information that can be viewed, check for viruses and specific file types, and actively block content. As the global leader in cross-domain solutions, Raytheon Trusted Computer Solutions has a proven track record of proactively enabling U.S. and international governments, Five Eyes nations, NATO, and commercial organizations to securely access and transfer information at various sensitivity levels, which in turn ensures that the right information gets to the right people at the right time, which is critical to our national security. All RTCS solutions are backed by a professional services team consisting of nationally and internationally recognized experts in security policy, architecture, planning, and implementation.